it's found in the tropics in southern United States. It's not known to be established in Ohio at this time. The Asian mosquito, the Aedes albopictus, is a related mosquito found in Ohio that could possibly spread Zika virus if it would actually become infected.
Well, the next slide is basically where the Zika virus has been found, and I know we're hearing a lot about that with people in their travel. Basically, Africa, Southeast Asia, Pacific Islands, hearing some with Puerto Rico lately, and I've been hearing, and we have heard that we're seeing it in the southern part of Florida, Miami-Dade area. There's a specific area there about a mile and a half. They did expand that. So how we're handling that at the hospital is we do screen every patient that comes in for their travel history, and we're looking at that. So that's part of what we're doing. We learned that with Ebola. We went through that, and that remained a mandatory piece in our assessment for our patients in our ERs, on our floors, observations, on our OB floor, and everywhere like that. So we did put a publication out to our staff with a website. If they have any question about the travel area, they can Google that. And I know our docs use that quite a bit. They get online and they look at a lot of things from CDC. So that's pretty much the travel piece of it.
Okay, how it's spread. It is spread by being bitten by a mosquito, from a pregnant woman to her fetus, from a person that has Zika back to the mosquito, and also blood transfusion. So that's one of those unusual diseases that actually humans can give to a mosquito, and the mosquito can give it back to humans.
Symptoms are pretty vague. They're most commonly is the fever, rash, joint pain, conjunctivitis, the red eyes. And I think the red eyes, what I'm reading the most, is one of the most predominant symptoms that you see with somebody. Again, you've got to have that travel history with that person or exposure to someone who has traveled or who has been diagnosed with Zika. So that's a very important piece, and it is a part even in the algorithms and screenings and stuff that are out there on that too. Joint pain, muscle pains, and headaches that go along with that too.
Okay, how does the virus affect people? Anyone who lives in or travels to an area with Zika and has not already been infected with Zika can get it. Many people infected with Zika virus won't have symptoms or will only have mild symptoms. So about 80% of people infected with Zika will not show any symptoms. Very kind of tricky there.
Yeah, and you're right, that's kind of the big part of it. People, they don't even know. Again, the important piece is that travel history. How does the Zika affect a pregnant woman? The Zika virus can be passed from a pregnant woman to her fetus during the pregnancy or around the time of birth, and they're pretty much saying any time of the pregnancy at all now. You need to be concerned. No reports of infants getting Zika through breastfeeding, however. UH has been working quite a bit too with our local offices on this, because they do have a team up there through McDonald House and Women's Health there, and providing them information in the offices on monitoring the pregnancies and stuff and looking at that piece. So,
okay, we're back up. Okay, so Zika infection in pregnancy is a cause for microcephaly and other severe fetal brain defects. Microcephaly is a birth defect in which a baby's head is smaller than expected when compared to babies of the same sex and age. Previous infection of Zika virus in a woman will not affect future pregnancies. That's a good thing to know. Microcephaly also, this is just a little added thing, is not only developed at birth, but infants that are exposed to the Zika virus from the mother should be checked also for microcephaly as they grow. So not only during the pregnancy, but once they're born, they can also have the microcephaly issues, so that you would want to be followed closely by your pediatrician and watch for brain size and growth and development at that time.
just a little bit more on this one too. The Ohio Department of Health does have a registry and stuff now where they're monitoring these, and they've designated 2 people at the hospital, Tabitha Rose in our OB department, and I'm number 2, to report those. And it's a form that is filled out if a baby is born there with any brain anomalies, brain reduction problems, syndromes of any kind. And so that is being tracked, and that was developed by a grant, and we are participating in that. So, okay, next one. How the Guillain-Barré. Guillain-Barré, that is It can be likely triggered by Zika and small portions of infections. It also can happen in other types of infections. Guillain-Barré is a very uncommon sickness of the nervous system, which a person's own immune system damages the nerves and causes muscle weakness. Most people do survive it, but it is, again, it's something ongoing that they could go back into again in their lives. They are seeing some bump in this with the Zika. Again, any infection process can trigger Guillain-Barré in people.
How is it diagnosed? Diagnosis of Zika is based on a person's recent travel history, symptoms, and results of blood tests. So you know that if you go into Samaritan's ER, the first thing they're going to ask you if you traveled. So that was even developed before Zika came around with our Ebola. A blood test is the only way to confirm a Zika infection, since it also looks like other mosquito-borne diseases such as dengue and chikungunya. So, you know, I'm glad that they brought that up, the dengue and chikungunya, because there are other mosquito-borne or vector-borne diseases that we may see or have present in Ohio, including West Nile virus and La Crosse encephalitis.
And we have seen dengue just in recent years. All right, how is it treated? There is no specific medicine or treatment. There's no vaccine. I think there are things in the works. Of course, there always are, but nothing currently available. So basically, it's symptomatic treatment of rest fluids, Tylenol to reduce fever. They do tell you to avoid aspirin. And really, that's basically all you can do with this. And I don't think we'll see a lot of these people get admitted, because hopefully these can be managed out in the community and at home. That would be the best place for them to be recuperating. But we could see some dehydration.
Brenda, is there any quarantine aspect to this?
As far as that, it is standard precautions with these people. Same as you would with any other disease. We're probably not going to need to do the arrest. There's no airborne aspect to it at this point in time. It is blood and body fluids, any form of that, again, with the mosquito transmission and that. So standard precautions, and extremely standard, you've got to do it in the OB and delivery department, just due to the amount of blood and body fluids that are handled there. So again, and standard precautions means if you're going to get splashed, you're going to have a face shield on. So yes, it's going to be gloves, gowns, shields, face shields to protect yourself from exposure to any blood and body fluids.
Okay, how is it treated? Protect yourself from the mosquito bites during the first week of illness, and Zika virus can be found in the blood for about a week. If a mosquito bites a person, it becomes infected and can pass the infection to others. So they do encourage you, if you do have the Zika virus, the first, I know it says 1 week of transfer from you to a mosquito, they do encourage you to stay inside for 2 weeks to prevent that.
7-14.
14 days, so that you are not bitten by a mosquito, so that it does not continue to develop in your area that you live.
A little bit different concept that we're protecting the bug.
The other thing too, we do have part of the Ohio Department of Health program to prevent the spread of Zika to the mosquito, is providing mosquito spray to the individual that has Zika, so that they always use it if they do have to go outside to manage that.
Okay, as we've been talking, it's primarily transmitted through the mosquito bites. You need to protect yourself. Proper repellents, and I'll tell you, there's so much online. We've printed up quite a few things here as to recommendations of repellents and things to, you know, adult children and that. So, you know, get online. I mean, most people can do that anymore. They're looking on their phones and getting that information. So,
Okay, where we are. Keep mosquitoes outside. Keeping mosquitoes out of your home and hotel. So if you are traveling and you need to stay in a hotel, try to choose one that actually has air conditioning instead of open windows or screens. It's easily lets the mosquitoes in easier if you just have open screens or open windows with no screens. Don't leave the doors propped open. And when traveling, use a bed net if air conditioning or screen rooms are not available. So here we are protecting ourselves like the people in Africa have for years, battling malaria with the mosquito nets. And I think we'll probably talk a little bit about this too. using a mosquito net for babies under the age of 2 months. You cannot use mosquito spray on them. Those mosquito nets are available through Walmart. I believe you have to order them, but that might be something that we really need to look into and encourage families that have those young babies and children that they're taking out with them, maybe camping trips, things like that, is putting that net over that baby, over the stroller.
Other ways then with the mosquitoes, as far as keeping them out of your home and away from your home, is the outside aspect of it. You need to empty, it shouldn't be water, tubs, even your fountains and things like that, you need to be very cautious of. Tightly covering any kind of water storage containers, buckets, and cisterns. Cracking a septic tank, that was something I hadn't really thought about. But anything that creates moisture anywhere. I mean, unfortunately, my mother-in-law lives right in front of a big swamp. She's not going to eliminate that, but the aspect of knowing those mosquito times and using your pellets and things like that. And also, I've been seeing a little bit more too about the larvae pellets being put in some of the water things and systems that you have to eliminate that reproduction, basically, those mosquitoes in those water features or things like that you may have outside that aren't just easily emptied.
Covering up, wearing long sleeve shirts and long pants, and treating clothing and gear, using permethrin to treat your clothing or gear, and buying permethrin treated clothing and gear. And read product information to find out how long the protection will last. Obviously, I'm sure it's only a matter of hours that it does, and you would have to apply again. And do not use the permethrin products directly on skin. The other thing that they do stress is if you're going to be wearing long sleeves, don't put the repellent on your skin before you put your long sleeves on. Put your long sleeve clothing on, then spray over that.
Again, using all of your repellents, using EPA registered repellents, using the DEET, picardine, all these oil, lemon, eucalyptus. I know people use Skin So Soft and all those things. Just make sure you're using something that is a repellent and that will work for you and is appropriate for the age of who is using it.
And always follow the product label. Don't spray the repellent on the skin and the clothing. We already talked about that. And if you're using a sunscreen, apply your sunscreen before applying insect repellent. The other aspect of these mosquitoes, they may not always be the mosquito types that we always think about. If you go out in the evening, you're putting your repellent on. If you do have the Zika type mosquito out, you may, at all times of day, before you go outside, put your repellent on and then go out. Many of these mosquitoes that we're dealing with are daytime or early morning feeders.
So as they move closer to us, we'll learn that, won't we? Again, we've talked a little bit about the babies and using appropriate repellents for them. Do not use insects if they're under 2 months of age, and using the screens and type things that Shirley has talked about. Covering strollers and cribs and baby carriers, especially when you're traveling down south. Keep the baby covered.
And also for babies and children, don't apply on hands, eyes, mouth, or cut on irritated skin. The adult puts the spray on their hands and then applies it to the child.
Yeah, protecting your partner, as we've been hearing more and more, is the sexual transmission with the Zika. Not man to infect it to the partner, but women too. Cases that have been showing that it's not been your traditional, it's been oral sex that it's been transmitted by, without any other penetration elsewhere. It's been oral, so it's still a risk of any blood and body fluids. We still need to be aware of that, and teach people that. Or there's all kinds of publications. If you're not comfortable talking with them about it, you can print things off for them. It lives in the semen for 6 months, so it's once they have been positive Zika, so it's serious there on the sexual side of it with the babies.
And doing your homework before you travel. That is, if you're pregnant, don't travel to areas with Zika. So the CDC does keep their website very much up to date, and they do issue travel warnings for the areas that have Zika. If you have to travel, talk with your doctor or other healthcare provider before you go on your trip. And if you are trying to get pregnant, talk to your doctor or other healthcare provider before you travel.
And if you choose to travel, you need to follow steps to prevent the mosquito bites, everything we've talked about, from repellents to barriers. And even if you do not feel sick, once you travel to these areas and come back, you need to be cognizant of that. Like we've said, 80% of people have no symptoms. So you travel to these affected areas, you need to be very cautious that you are not being bit during those. It says up to 3 weeks. I mean, that would be very cautious and hopefully good enough to cover that so that you aren't spreading it to the unaffected mosquitoes in the area that you're returning to.
Okay, do your homework before you travel, and it does list the sites that you can go to, the Zika sites. And you can see here our wonderful Sarah Goodwill Humphrey was the one that put this PowerPoint together, and I do want to thank her because we presented her PowerPoint. Thank you.
Very good. Any questions, comments, thoughts before we go to the, yes, Lynn?
Just to clarify, when you guys are talking about someone being bit by a mosquito, the person has the Zika,
Yes.
and the mosquito bites you,
Yes.
then can transfer.
Correct, because it has your
Is
infected
that
blood
any
in it.
mosquito, or does it have to be one of those?
My
two?
understanding, it could be any mosquito. You can
So-
infect any mosquito and it can transmit.
Okay.
Right?
There's different species, the Culex,
Yeah.
the Aedes aegypti. The Aedes aegypti is the one that's known to be the carrier.
The
So-
carrier down south,
Right.
but that we wouldn't have those here.
We don't
So does
have-
our regular mosquitoes bite, if I had it, and they bit me, would it?
Sure. So we have
Would get it?
Aedes albopictus, which is the same species as the aegypti. Albopictus is known to transmit in laboratory settings, so they believe it can also happen in the natural environment. They have not any cases, but they've not taken that off the table. So that's why our level of concern is where it is, because there is that.
Theoretically.
Right.
Theoretically,
Right.
Good. Anything else? Comments, questions? All right, so perfect timing. We're going to move into the exercise. The first few slides here are just going to go through quickly, introduce what a tabletop is and how it's supposed to work, and what our role is as participants. And this is as Mark likes to say, participative environment, right, Mark? It isn't just asking questions. We need everybody to think. Okay.
Anybody that doesn't ask questions or talk today gets to stay an hour longer than everybody else.
Yeah. Yep.
No, you're not done.
So here's our agenda for the next half hour or so, is to talk about how it works, get into the tabletop exercise, expectations, and we'll do it, and then we'll review what we've actually done for this afternoon. Now it's a little bit blurry. Okay, so the purpose is really, it's a discussion. And it's facilitated by a facilitator. In this case, it's going to be Mark. And it's a group exercise to think about what problems do we need to work on and maybe come up with some solutions to some problems or recommendations, but not to get all the way down to where we solve the world problem, just to get some conversation going, okay? They're usually evaluators. We have not assigned an evaluator for this. I think we'll probably self-evaluate, and we'll do a good after-action review to help us with that evaluation piece. This barred portion is really important. The success of a tabletop exercise is determined by feedback from participants and the impact this feedback has on the evaluation and revision of policies, plans, and procedures. So I don't know if we have a county plan yet. I know we don't have a plan at the hospital, a written plan. I'm not sure if Mark got anything going at the EMA level or maybe within other organizations, but this information we want to feedback will certainly help us with writing those plans and procedures. So there's advantages and disadvantages. Advantages of this type of an exercise, it's just modest commitment in terms of space, so that's why I didn't have steak and lobster. It's a modest meal of pizza and soda. Okay, it's an effective opportunity to review plans and procedures, although we don't have any of those with us today, but we can certainly talk about some of those things. And it's a good way to acquaint ourselves with one another and some of these various procedures. The disadvantage is it lacks realism. Okay, it's a superficial exercise, and it doesn't really provide a practical way to demonstrate overload on a system. So We're not going to deal with the actual scenario today in reality. We're just going to talk through it, and that has some disadvantages. So, what are we supposed to do here? Respond to a scenario based on the knowledge and expertise. We're all players. We just learned a lot about what Zika is, so some of that information we'll want to put back as we talk about it. Okay. Observers normally do not participate, and Mark's our facilitator, and we talked about the evaluation piece already. Okay. Some assumptions here. The overarching comment: don't fight the exercise. And as you'll see, our scenario is very, very basic. But so one of the tendencies for folks to do is, well, that would never happen, and they start that right out at the beginning, and it just shuts down creative conversation. So the scenario is plausible. The events occur as they are presented. There's no hidden agendas or tricks. I mean, we're all going to get the same kind of information to think about and talk about. Okay. So some things that we might think about updating afterward: incident action plans. Okay, and maybe even creating an incident action plan in advance. So if we know what this might bring to us as a community, as a hospital, as public health, can we maybe write a plan in advance of that and be better prepared? The other documents that this will feed into is our emergency operations plans, and all of us have EOPs: hospital, public health, county. Fire's got one too. Every organization's got some sort of a plan to deal with a variety of different disasters. And the last one there, if you can't see it, memorandum of understanding, MOUs. What do we agree on between hospital, response, EMS, public health, EMA to do should we have a Zika type outbreak that requires all of us to collaborate and work together. And I'll throw the media in there too, because you'll have a big role, right? Making sure that nobody freaks out about this in the community. Okay, no school solution. Respond to what we know. Kind of think out of the box. Everything is fair game, and be prepared to ask questions. That's a good thing. So, anybody have any questions on what we're going to do or how we're going to do it? Perfect. So now, Mark, you want to lead us through this?
Absolutely.
Little trigger here to get through the slides.
First of all, I'm very happy to hear that we have public health folks in the room, we have hospital folks in the room, and we have Debbie with the university here. What I am concerned about is I don't see anybody here from public education as far as school nurses and those kind of things. And the reason I bring that up is that those nurses, once the kids come to school, are going to be the first people that those students go to saying, I don't feel good. And they need to know whether they're going to be able to do anything about it is one thing, but they're going to need to know and be educated of what the symptoms are so that when they come to them, they understand what they're dealing with. Like Debbie, the university is now being flooded with many, many students who are flowing on campus, who don't live here, who have come from various parts of the country, come to Ashland University and the world. We don't know where they've been. We don't know what their history has been all summer long. We don't know what they've been exposed to. And now they're all together in one place. And not only that, they're all together in our community. They're not just on Ashland University campus, they're in our community. So they're doing what we all do, but now they've been places that we haven't been. Not that that's a bad thing, it's not a bad thing, it's a fabulous thing. But the problem is that we have no way of capturing that. We don't know what that history is when somebody comes to the clinic at the university and says, I don't feel good, and they're experiencing the symptoms of Zika. If we don't know what those symptoms are, we can't even begin to ask those questions. And obviously, you're going to ask to do traveling. Well, if you came from another country and came back to school, obviously you traveled from somewhere to get here. So we need to be aware of asking those questions and getting that kind of information. I know it sounds basic, but if we really want to control this thing, and we really want to get a handle on it, we need to get used to asking those kind of questions. In order to formulate a plan, I'm getting to why we're talking about this, and that's the plans that we have. If we don't lay the groundwork for education to everybody understand what we're dealing with here, we can't possibly get a handle on it. Because there's going to be somebody slip through the cracks that just says, well, let's add one more wrinkle to the fact. What season are we coming into? Flu season. Imagine that. What has happened every time we've had some kind of major worldwide epidemic? What time of year does it normally come? It comes at flu season. So how do you distinguish flu symptoms from any other symptom that walks through your door? By asking those questions. You have to start narrowing down that criteria. And that's what we need to do. And we need to educate ourselves really hard on making sure that we ask those questions. If we can't ask those questions, we're not going to get to where we need to be. So, the scenario is we've had 10 people that have symptoms consistent with Zika that have presented themselves to Samaritan. Given a media release that there are 10 people in Ashland County who are infected by the Zika virus, what requirements for diagnostic workups, infection, treatment, prevention, interagency notification, and coordination and response to the inquiry, media inquiry? Well, we don't know where those 10 people are. I don't know where those 10 people are. I don't know where they've been. They could have been university students that presented themselves and have now gone to the ER at the hospital. They could have been anybody on vacation who may have traveled. They could have been somebody out in the backyard. I contend that we are very lucky in Ashland County, maybe not so much in other parts of Ohio, but certainly in Ashland County as we're in a drought. For all practical purposes, Ashland County's area is about as drought-stricken as anywhere in the state of Ohio right now. So what does that do to our mosquito population? It certainly keeps it low. I contend the reason that nobody's making a big deal about Zika is nobody's getting bit by mosquitoes right now. If you were out in the backyard getting bit every single night, and all the media hype was about mosquito-borne illnesses and people spreading Zika and doing this and doing that, I guarantee you the ED would have people walking through the door going, I got bit by a mosquito in my backyard and I'm concerned that I have Zika. Am I wrong? They would be overwhelmed with people. But because we do not have that situation, I contend that that's why we haven't heard a lot about it locally. That's my argument, and I'm going to stick to that, because people are creatures of habit. You know, if they hear something on the media, they hear it on the news every night, all of a sudden, wow, that could be happening to me. You know, and all of a sudden I'm starting to experience the symptoms of maybe, I did see a mosquito the other day. It could have been in my backyard, and the next thing you know, ED's overrun, and we're going to have to defer patients to somewhere else because we got 100 people sitting in the waiting room. So, we don't want that. We have 10 people, and this is where we're going to go. So with these 10 people, we're going to identify the requirements to educate, triage, diagnose, and treat the patients suspected of being infected. That's the first thing we're going to do. The other objective is we're going to identify the resources required to prevent and manage the Zika outbreak. What's that going to take for us to be able to do that locally? We're going to determine key elements and interagency coordination. We have a room full of people that have come from various walks of life as far as our professions go. We're going to have to learn what we're going to do to work together interagency-wise. We can't work in our silos anymore. We can't be the hospital. We can't be the health department. You know, we can't be the university. We can't be whoever it is. This is bigger than us. We all need to work together and figure out how that plan is going to work. Because if we don't, where's my media rep? Right there. My media rep, maybe not her, because she seems like a very nice person. But somebody in the media is going to say, what is Ashland County doing collaboratively to work together to try and get a handle on this before it gets out of hand? There will be media reports. They'll start asking questions. Those who like to carry microphones in their hands will shove a microphone in your face and ask you a question that you may not be ready to answer. So the object is, let's be prepared before we get there, understand what our plan is, and know where we're moving forward to. So, we're going to discuss the methods to manage the media and also educate the community in what we need to do to educate them on what Zika is, how it's being spread, how it's not being spread, and try to stifle some of those rumors. Okay. This is an interesting slide. When I saw this slide, I thought, Zika?
That's what it can do if you're not prepared.
And I think what this slide represents to me, and it's what I wrote on my piece of paper, is it's when stuff hits the fan and everything is going on, we are there. Now we are there. And the stuff has certainly gone crazy.
Yeah.
So, our problem is, what are the screening questions and considerations for healthcare providers? Anybody answer that question?
Have you been in a foreign country?
Have you been in a foreign country?
Symptoms and travel history.
Symptoms? Anybody else?
Not just foreign country, any travel.
Travel, yeah.
Any traveler? We just heard that it's in Miami-Dade, Florida. That's not a foreign country. Well, it is kind of a foreign country. Seems like everything questionable that happens in life starts in Miami-Dade, Florida. I don't know what that is, and there's a lot of TV shows about Miami-Dade, Florida. So,
I have a quick question.
yes.
From the time that you're bitten by an infected mosquito, what is the time frame that you would be positive in a test?
7 to 14 days is what we're looking at. Travel within 14 days.
And with that being said, it's important that screening questions also include, have you had sexual relations with an individual who's traveled?
Absolutely. And that is part of the screening process here too.
Yeah, because is there not a new thing that came out that said if you are tested positive, thou shalt not have sex for
Yeah. For women,
14 days, maybe a month
For
now?
women, it's 8 weeks. For
8
men,
weeks.
it's 6 months.
So. And they were considering moving that to like 6 months. So, again, that's going to be one of those things that's going to be very hard to enforce. Because we're all creatures of habit.
So would it be fair to say, I wrote down here on screening questions, like with Ebola, we had standardized questions and we had a script. So I just wrote down for our plan, you may want to consider standardized questions and some sort of a script, so everybody's asking the same thing, handling that the same way, whether it's Debbie's student health center or the ED or someone coming to public health or a doctor's office, which would probably be another stakeholder in this whole thing. So.
Okay. Where's my ED people in here? There she is. Anybody else in ED? Poor Chris, you're all alone here. Chris, what are the clinical indicators that someone is infected with the virus? And I ask you because you're going to be the first one that sees it.
Well, all the flu symptoms. Exactly. Headache, fever, headache.
And the red
Dental
eyes,
pain. Oh, wait, no,
conjunctivitis,
that's
red eyes.
Okay. Debbie, if somebody comes into the clinic at the university, can you identify those indicators?
Can I identify them? Questions to ask?
Well, we have a series of questions to ask. You heard those talked about. So when somebody comes into the clinic at the university, and we all know that they've all traveled from somewhere, because not all of them live here. So we know they've traveled, they come in experiencing those kind of symptoms. I guess I'm saying to you and your staff, they need to be aware of the questions they need to ask them, because your next move probably is going to be, if they match the question deck, is you're going to send them probably to the ED, and they're going to want to know that those people are coming and that they've been screened that way, because they're going to need to deal with it when they get there. So the communication here is going to be critical, and that's why I wish there were school nurses in here as well, because they're going to see those students first.
And then too, I think it would be helpful too, that not just calling ED, but the health department, local health department too, because they're going to work with us to get that testing.
Sure. And it's the first response is always go to the emergency room if something happens. I mean, in this day and age, without insurance and things, they get overrun with people coming to the ED with a variety of symptoms. Health department usually isn't the first place, if you get sick on the weekend, that you're going to go to the health department. However, the health department needs to be in on the ground floor of this whole thing as those cases present themselves. Then they can start building a history and things of what we're seeing here locally so that we can build that plan that we're talking about over here. And once we see that, we can start educating the community. We can start educating our staffs, probably. Does anybody have an educational meeting with your staff about Zika?
We've had discussions at the hospital.
I was going to be worried that nobody in the hospital raised their hand and they've never had a discussion about
We've
Zika.
had education up for months.
Right.
There's some
Yeah.
questions.
And
And Zika is also nationally reportable, and in particular in Ohio, it is a reportable disease. So most healthcare providers at this point in time is well versed with the ABCs of reportable diseases, and Zika is one of them. So they are mandated to notify the health department within 24 hours of a suspected case of Zika. So we will be in, and I imagine we'll learn much earlier than that 24 hours of the potential and be able to get some of that epidemiological investigations underway.
So if they go to their doctor, if they meet the criteria for potential symptomatic, they need to make that notification to the health department.
Can I just raise a question for discussion?
Sure.
I don't understand why we would have them go to the ED. Because there's no reason to go to the ED unless you're so dehydrated you can't stand up. Because we're just going to transfer it from the doctor's office or the health department or the
Deb, do you
college
guys do
to
flu?
the ED.
Do you do outpatient, can you guys order outpatient flu swabs and lab draws? For outpatient, you're not sure?
Yeah, I'm not directly affiliated with
With
the
the
health
clinic.
center, but I'm.
They have in the past, right? Because they send it in for TB testing and everything.
Okay, they do.
Health can send in stuff. I've seen it. They don't have a PA right now.
Dr. Boyd.
I know Boyd's over there.
Yeah, Floyd's over there.
Because he called yesterday.
No, I'm just asking, because if they're not if they're not ill
Right.
or low blood pressure or dehydrated, why can't we just create, since we have all these great minds in the room, why can't we create a system before it happens that they don't just get pushed to the ER? Because it's going to transfer it right from there and there and
Warm and
there
Mark's part.
to the hospital. We don't need to have a patient there for that.
That's true, what you're saying is
Sorry,
valid,
Mark.
but you also probably experience.
You can go home now, Mark.
that
Your day's been made.
Some of those ED visits that don't necessarily validate an emergency situation, like they don't have a primary care physician. So their catch net or catch-all and safety net is the emergency room. So I think that's what you're gonna probably experience.
And we do experience that already. That's
Yeah.
why I'm trying to say, is there a way we could coordinate a better effort
It
to
would be
get it
great.
reported properly? If they need a blood test for Zika, get it done. It's not going to be known that morning or that day anyway. And why not avoid a big catch-all to the ER if we can coordinate an effort with this exercise here today?
You know, Bev, I wish that I would have brought with me better prizes today.
Oh, okay.
All I have to offer you is this lovely, nice Samaritan University Hospital set.
Yeah, I think what you're addressing is the fundamental problem of healthcare is many people don't have a primary care physician.
Right,
And if we could give them that
Yeah.
resource, we would be able to really make our healthcare system efficient and effective, but
Yeah. Oh, I'm
We're
just
not
saying,
there yet,
but it's a good.
But
right.
we're not there yet.
Right.
But we're getting there with comments like that. If we all think that way, instead of pushing people on down the line, at least we can identify early, pass on information if we can, treat if we can.
Right.
And tell them to go back home and take their time on and rest and drink plenty of fluids. Because I think that's what we're going to tell them. I really do.
You can't educate them enough really to get that panic level.
Well, exactly.
Exactly.
And that's why I threw it out there. It's a panic level that you cannot educate to, because it's happening to me. I don't care what happens to my neighbor across the street, but it could wander across the street and get me. So now I'm worried. If he's got it, I may get it.
We saw it with Ebola, with phone calls to the health department. You know, my neighbor just came back on that flight from Houston, and I'm sure they were in the same airport as that person. I mean, we got these calls.
So we can do Zika testing on an outpatient basis here? Like
Yes.
primary care orders the Zika test?
Oh,
It would go through the health department, I would have to get it, and is Reynoldsburg able to do it, or is it going to all the CDC?
We are doing preliminary testing at ODH.
Okay, I had to ask you.
And then they do
They
confirmatory at the CDC.
So it does need to eventually go to CDC?
Yes, so,
Okay, so.
yeah, it'll go to ODH first for that preliminary.
They can
What's
order
the
it,
turnaround
so they can order it, it's gonna come to us, we're gonna call the health department to get approval to ship that.
Yes.
Yeah.
Sarah, do you know a turnaround time on that?
It is much better now, I'll tell you,
I heard it
I
was
shipped
really
off
bad
my
at
first Zika sample in March from Novellis County, and it took me well over 6 to 8 weeks to receive that back. I know.
That CDC
That's
website
my
says 2
point.
to 4 weeks.
Yes,
Like,
and then
yeah,
now
so
with the ODH turnaround, with the preliminary testing, you're going to get that back within a couple of days. They're very good. Now, you won't get, they will only label it as a suspect case.
Okay.
And that we are,
Quantitative.
yes, so they will then go down to CDC. And it could be well into the convalescent stage of that individual before we get the confirmatory. That's why we won't wait to do our public health interventions. We'll do those immediately.
Thank you for bringing that up, because we've learned through swine flu, we learned through Ebola, when we send samples off to a laboratory, the magic laboratory, whether they're hand-delivered by highway patrolmen or whether they're hand-delivered by individuals, and they go there and they make sure that everything's done right, we're still looking at this window of time. In the meantime, that window of time probably causes us more grief sometimes than finding out you've had the symptoms to begin with, because now you don't know. And now it's gone off somewhere and it looks really bad because you've sent it off to a state laboratory, and now you're going to send it to the CDC. Oh my God, I must be dying. And so that panic level, anxiety level just starts building. And we as a community need to figure out the educational piece to the community and to our staffs of how to lower that anxiety level and lower that scariness, I guess. Panic level was the word I was looking for. See, I'm glad you came today, Beth, because I can't talk.
You and me.
So, all right, where are we?
Last, I want to write some things down here. So for the last bullet there, pardon the interruption, let's just throw out some things that should be included in the plan. I've already got a couple things listed up here, but if we could just do sort of a rapid fire, just what should be included in an infectious disease plan, whether it's a public health component, whether it's a hospital component, just to get some ideas for plan structure on the board.
Precautions needed.
Precautions? Okay.
Precautions needed.
All right.
Discharge information for
Should be like a
decreased
pamphlet of some kind.
Education sheets, I'm sure that.
I've got a whole table of
CDC
laying
has-
back here too.
She's
that
really
really,
something.
Okay.
Take one.
yeah, they're in the back table back.
All right. What else?
Well,
Precautions, education.
reporting, just reinforcement of the reporting mechanism to keep
Follow
a
up and
handle
reporting.
on,
Yep.
Reporting?
making sure all people involved know how to report to the health
Yeah.
department for centralized reporting.
And what about referrals? Oh, you refer?
Referral,
Okay.
yeah.
And I think just follow up with these patients too, because when you're waiting in the labs that long, you know, that they need a support. Again, during that period of time you're talking about where it's kind of lost and you're just waiting for results. So they should be doing good contact with me during that.
I think it depends on your patient too. If it's a pregnant woman, you're going to have a whole different scenario to deal with.
Right. Well, Brenda, would you
Male,
be doing some
female.
differential testing, like do a flu test too?
Possibly, yeah, you're going to be ruling out, and you're recommending, in the flow sheet too, it talks about dengue, chikungunya, looking at those other diseases, based on that trial history, yeah, you know.
Yeah, I was gonna say,
Prevalence
because that's
of
what you're not gonna go, you're gonna probably run an arbovirus panel to figure out if it's in West Nile or across. You know, rule some of those out and then do at the same time the chikungunya, the dengue, and the Zika, which is a separate. So you, yeah, you're kind of doing pretty inclusive.
So what would be, I mean, would do a flu test to see?
It would be possible that they would look at that depending on the period of time and their symptoms.
Lab testing requirements.
They're gonna do those rule outs, I'm sure.
Ken, anything from the EMS side, on the slant?
That was my question. We've talked about walk-ups to the ER, we've talked about people going to doctors, we've talked about people going to clinics. I don't want Ken to stay an extra hour because he hasn't said anything yet. I'm going to make him say something and say, Ken, from an EMS response, when you get a call to a residence, and what are your questions going to be to those individuals? A lot like they are now, probably, but
Oh, you couldn't catch me. To make me stay. What a perfect world
I've seen
Bev
that.
lives in. The bars crossed. What a perfect world Bev lives in, huh? Ask Chris Coffey in EMS, how many calls to the ED and to 911 are emergency calls?
Oh, yeah.
I know.
10%. So, the world we live in.
Is it 10%?
Yeah.
Just like Ebola, I think Steve mentioned the can. These are the questions, not just what do I think these questions should be, but the can. This is what we need to ask. And that started at dispatch, if you remember. Ebola.
Right, signs on the windows, right?
The doctor's office, the scripted, they were reading those. So I think that was important. So early, you know, asking early, and then EMS response, universal precautions, we mentioned that, and early notification to Chris, just like we did with all the other stuff. That early, hey, this meets that criteria, recognizing this demographic. You know, we talk about UH or AU, those certain demographics, and putting it all together in early notification. We came in different routes. We didn't go through the Montgomery, we changed.
Right.
So early, for us, it's going to be early, those questions early, and then universal precautions, and early notification to the
Look at the bright side. PPE is much less this time around.
Oh, I still have all that stuff.
Okay, want to move on, Mark? Here's the next kind of the scenario.
Okay, the hospital emergency, as personnel of the ED, you are concerned about controlling the spread of the infection and ensuring that the public is getting timely and accurate information. What steps is hospital and public health, what should they do working together to address the spread of the infection?
Well, we're going to use standard precautions. I mean, as far as our wonderful infection control nurse, Brenda, does a great job at reporting. On discharge, well, depending on how severe and what other comorbidities are going on with this patient, I mean, we'll do discharge information as far as, because they're going to be suspected for as long as the testing is going to happen, or take place till those test results come back. But as far as precautionary measures, you know, to use bug spray, to, if it's a male, we're going to tell him that it's spreadable through his semen for up to 6 months, as well as for the females. Not only the females that may be pregnant, but if they're planning on conceiving in the next 8 weeks, is that what it is? Mm-hmm. 8 weeks on the females, that they need to use.
Put that off for a while.
But also to piggyback on that, I think that the role of public health too, when you have those people in that emergency room, that you're calling us, even with a suspect case of Zika, that we make contact with that client also. And it is a reinforcement of the educational materials that you'll be giving at the hospital to make sure that they're taking those precautions so they hear it again from public health.
And to show that public health has a presence there, the intent is as long as the cases are manageable, we have the staffing capability, we would utilize our environmental health staff to go out to their location to do an environmental assessment, to help them do things such as breeding ground reduction and and things like that, and really identify ways that they can do some preventative measures on their own, as well as again share and reinforce the educational material that they receive. And then as the state kind of releases more grant funding, we're getting things like insect repellent, and if, should they need those, we are there to provide that and kind of help facilitate, kind of empowering them to do some of the prevention of spreading it to the indigent, I guess, not indigent, but the indigenous mosquito population. So, because they may come in, but we don't want it to take hold. So we're going to do what we can to prevent some of that.
Yes,
A couple weeks, we'll have the Ashland County Fair, maybe pamphlets. We'll talk about some-
Yeah, we talked about it when we met, to put those out, to help department, you said you are going to be there.
We'll be there, and there is a
How many-
presentation and pamphlets back there.
How many different groups in this room are going to have booths at the fair? You're going to have one, I'm going to have one, the hospital having one this year, and none at the hospital. Health department will be back. My suggestion is that if you have a booth and you can spare this much space or whatever to provide any information we can to the public, it's another opportunity for them to pick up information to be able to read it and educate them. That would be my recommendation. So, just, if any of you don't know in this room, this lovely lady sitting right over here on the end, and this lady sitting to my right over here are almost joined at the hip when things like this happen.
Our offices were together, really, to help be helpful.
We watched it during measles, we watched it during Ebola, we watched it through every outbreak we've ever had, and I can tell you, almost on a continual basis, at least several times a day, these two people are talking. So when people say we're not working together, there are things working together that are not visible to just everybody, but they are happening because I see it and when I want it to happen. So, how will the media response plan be created? This is going to be a good one because you guys are now under University Hospitals. And I don't know what the media policy is for UH now, the little Samaritan down here. It used to be easy. I don't know if it's as easy, Jill, as it was before. Is it?
Some things are not.
Here I came.
Here's my hope, that if we put the facts out there, and that we create a media plan that gives what we need the people to know, and it's factual, it's not based on some fairy tale somewhere, and we put it out there, nobody should have an issue if we all agree that that's the information that needs to go out to protect the people of our local community. I'm hoping we can go there and it doesn't have to go up the chain, be approved, and come back down again by somebody else. Yeah.
Keep in mind, we've used the health department to release
Correct.
public information.
So if
Ray's had
together-
Ray talked about his piece, you talk about your piece, everybody.
Right.
Almost a unified.
But we need to talk about the same piece
Right.
when we're talking. So, if the media calls the hospital, and they're going to, and they're going to say, I hear you've got 10 Zika cases that have come through the ED, and I want to know what we're doing about them, or how are they contracted, and where are they, and where do they live, and all of that.
We've been able to manage that locally so far. So we would address the situation. I think what UH might bring to us is a larger amount of experts that we might be able to pull from and put in front of the media for questions that can also work with our local experts on the issue too.
My hope is before any media thing goes out, this group and this group come together and talk about what that release is going to be. So if we don't do that and we end up with this, we're just going to end up in chaos before it's all over, because health will put out something one day and the hospital will get approached by somebody who's not even expecting a media person to ask them a question, and they'll just off the cuff go, well, yeah, we got people or something. And the next thing you know, we got a news story that we didn't know we had.
And keep in mind, when you don't give information out, they'll make up information. So
That's right. When Steve introduced this young lady right here and said she's here because the media is our friend, I want to go on record as saying that this young lady is one of the best friends you could ever have when it comes to times like this, because getting her accurate information and making sure that she understands exactly what's going on in a way that is going to be non-threatening but factual, which she can print and put out there, and don't allow minds to wander and try to make up stories that don't exist. Make sure she gets that information on a regular basis. And I know you will, because I've heard good things about it. Not just from Steve either. I've heard about it from other people. But we need to use our media to our advantage, because they are our friend. And we need to use not just the Times-Gazette, but we need to use multiple media venues in order to get that word out. Your Facebook page, I don't know how many people Twitter, and put it out on Twitter. You know, the Times-Gazette has their own electronic version they put out with breaking news stories and things. It's a great way to get information out that way. So any way that we can get that out, but the message needs to be the same. Whatever it is, however it goes out, it needs to be the same on both fronts.
I got a question. Would it be advantageous or is there a risk involved in creating some sort of proactive media release? So, for example, after this together session we had today, would this be like the launch point for, hey, we're going to go out, and then Ray's been working on Facebook a little bit, but should we go bigger and bolder, if you will, as a community with the message to sort of get at some of that preventative and putting the community at ease versus waiting till it does happen and then trying to catch up? And what do you all think about that approach? Or
Personally, I've been reading about this practically every day since last fall, and just find it fascinating. And I can mention it to people in my family who travel and stuff, and they don't care, they don't know, it's not a big deal, it's down in Brazil or whatever. I just don't think people around here are taking it seriously for the very reasons that you said. And I think that anything that we can put out there about it, indicating that yes, it's not a problem here yet, but these are the issues that it can be. I mean, you already said we got, what, 80 people in Ohio? Or 7?
There's 43 travel associated with it.
Yeah, and even though that's how they may have got it, like you said, with the sexual transmission, doesn't mean that that can't go all skyrocket crazy, you know?
And the other
So
very valid
I just don't
point-
think that people understand the possibilities. of it.
Anybody in the room grow up in Ashland, Ohio, besides me?
Ashland County.
But lived in Ashland County all your life. I can tell you that we in Ashland County have lived a very sheltered life. We don't realize that there are people across the street and maybe next door that travel out of state, maybe even travel out of the country, for Pete's sakes. You know, that's big news, and they come back to our community. We don't pay any attention to that because it can't happen here. It won't happen here. We're Ashland County. We're a long way from all that big stuff you see on the news at 6 o'clock.
But a lot of these
Yeah.
preventative measures that we share are not just Zika specific. We have lacrosse encephalitis, we have West Nile virus, everything that, a lot of these protective measures use EPA regulated insect repellents, use screens. All of them will apply across the board to many of the arboviruses that we actually do have in our community on a pretty seasonal basis. So I don't think that it should be just when we need it. I think it should be, granted, that's when they'll pick up on the messaging. 2 weeks after, they were hoping for, but we'll always have a constant presence of that message.
The only reason we're talking about Zika right now is it's the hot button that's been created by those serious situations that exist, just like Ebola and those other things. Does the Indiana mosquito know when it hits the Ohio line? And it flies over here into Ohio, bites somebody, and it flies back to Indiana? No. So
I think some of that universal messaging is a really good idea because whether we use the word Zika or, Zika is unique because it has that sexually transmitted aspect to it. But again, a lot of that messaging can be used currently to stave off West Nile transmission and and things like that. So I
Maybe
think that's
you
really
could-
important.
Periodic health articles would be helpful. You guys
Right.
periodically run, once a week, once a day, or whatever, the one on animals, and the vet does one. You know,
Right.
you need a periodic one for healthcare.
While we're on plans, what are some of the key messages that we're going to create? What things do we want to put in a message to get out there to the public?
What the risk, prevention.
What the risks are, what the prevention is,
Recognition.
The symptoms.
symptoms, treatment.
People, I was going to say, there's going to be a lot of people that are going to be traveling now that it's going to get colder. They're going to go
We're going to go south,
Florida and go.
probably end up somewhere near Miami, some of them maybe.
Or south.
Just saying, you know, it's warm there. Anybody thinking of going on a cruise? Want to know where most cruise ships go out of?
Did you notice that about the time that this really started to get to spearheading, probably 6 or more months ago, that all of a sudden you saw all kinds of fabulous deals on cruises being offered? Because, no, I'm not lying, they have overextended themselves on this because they're noticing the cutback of people not going because of this very thing in the Caribbean.
That's what I'm saying.
So they're trying to give them away now.
There's nothing good at
Okay. So, we talked about what media we're going to use and all of that, so we're good with that. We're going to do an after action now and find out, how do you think we did? What did you think of the content? I know this was a very short, most tabletops take anywhere from 2 to 4 hours to work through an entire scenario because you got a lot of things going on. What did we learn about tabletops in the beginning? They were a discussion. And I think we had some really good discussion here today. So what did you think of the content? Was it enough? Was it too much? I didn't put this together, but Steve and the hospital staff did, with the help of the health department, with your background stuff from the Zika presentation, which was excellent, Sarah, and the health department. Thank you.
So we'll just do like a plus and ups and downs, you know, what went well, about content, what do we need to improve if we're going to do this again, or in terms of the exercise itself.
I think some of the content we didn't touch on is managing symptoms of infants with congenital Zika virus and follow-up treatment and education and support for those families that may have a Zika-affected child.
Okay.
Post-infection care.
If we're talking about support for infected families, and where would that primarily come from? The health department, the hospital?
Well, there's the BCMH is sponsored by that. We're sending, when one is born here, I mean, it's a big form that we're sending, and then BCMH is managing that.
Right.
The grant that they have they're supposed to send a team immediately in to speak with that family and deal with that and help with that.
What's a BCMA? I'm sorry.
Urban Child
Handicaps.
So do we have, as far as lab order sets, do we have what we need in-house? What would they be drawing on as far as education for testing for the send-out?
Well, the sundown, I mean, it's
CDC.
probably, it's just a serum.
Is it a blood test or is
Yeah.
it?
Blood
Yeah,
and
that's a serum.
blood and
It's a blood
serum.
test.
Are they still doing just the blood test, or are they doing the urine now also that the
It's-
CDC was recommending? I think it's, with babies, I think they're doing the urine and the serum. And the serum, they're not doing the results. Right, I don't believe so. I have the information.
I know,
It's
you-
filling that up.
I that months ago when I did my
Sure. I have the latest key messaging and things like that as of September 7th, so I go through here.
I know.
So I guess my question would be, you know, if we had a patient that said, yeah, I've been in Brazil for the last month because of whatever reason,
And they come with these symptoms.
and I didn't have a med, I was bitten to die, whatever. They have the perfect symptoms, the classic symptoms. What do we have as far as to, you know, the process for our testing to kind of move forward with what we need to do?
So you're asking, like, do you have the serum,
Okay.
yeah, do you have those on hand? Do you know where to access the submission form
are you going to send it?
Right,
That
that's
would
right.
all
Are
go
you-
to the lab and we would process
Oh,
that.
yeah, I would say, would
We've
you
done
send it
that
straight to
before.
ODH, or would you use the health department as a, courier per se down there, So ththose are, I could see working some of that out.
Yeah, so I put that on, I kind of created another need more work on things. You can get after it all day, obviously, so I put education
And what them,
on
and what to expect afterwards.
Right.
One suggestion I have from an EMA perspective, because I'm the resource guy. In all of this, EMA is the people that get stuff. If you need stuff and you need to go to the state, you're going to find that any state resources that if this would turn into an epidemic, much like Ebola and everything else, any state resources come to our county by way of my office. I have to sign off on it because that's just the order that it happens. I didn't make the rule, I'm just the guy. So I guess I'm going to ask if Samaritan would get test kits and things and submit them. My suggestion would be to run those, and Sarah, I don't want to volunteer you for anything, but I would run those through the health department and let the health department courier those to where they go for one reason and one reason only. It creates a loop between the hospital and the health department that we all know what's going on. We know how many went, we know who they were, we can track those on the backside coming back, and it's all clean that way. If we start sending this and sending that, pretty soon we're going to lose track of how many went, how many we have, and all of that. So that would be my suggestion.
That is an agency that I was at previously. That is exactly how we ran our measles outbreak. We would get notified from either the healthcare provider or the hospital that a sample has been drawn. And then we would take on that kind of leg work of getting it down there with the completed paperwork, and then we kind of, made sure that we were intertwined as far as the information chain went to. They would, kind of get the results back in tandem. The public health side was able to do some of that, again, epidemiological investigation. The hospital was doing the care that they needed to do, and so it really did bind that relationship. So I would like to see that be how a Zika kind of response would
Because again, from an epi side, the health department is charged with being the department that has to track where that is, doing all the investigations and all of that stuff. Legally, they're bound to be the ones that do that. Samaritan's not going to go out and run around and knock on doors and start asking questions and doing all that. But I've seen these people do that during every outbreak we've had. They're out knocking on doors, asking questions, documenting everything that goes on, and this is going to be much the same if we have an outbreak. So I think that's probably the best process to use because it keeps it clean, keeps everybody in the loop. And again, the media calls or somebody calls, we all have the same answer. Yes, Jim?
This may sound like a silly question, but let's say my husband traveled and came back. 2 weeks later, he's not feeling well. Again, it's like flu season. Do you, let's say he did end up having the Zika, so would you then assume that the household be tested? Or, I'm only...
And there's actually testing criteria. They have an algorithm already, so, just,
Well, that's what I was-
household contacts are not naturally gonna be tested. Now, as if you came, they won't test asymptomatic carriers, knowing that, 80 to 90% of the individuals won't be symptomatic. So you would have to present with those, and then they would kind of trace it back to what were your risk factors and then test from there.
So you wouldn't just automatically assume
Right.
or test that. Right, that's kind of what I'm looking at, but I was just kind of thinking,
Right.
I don't know.
Again, that messaging would be shared with the family, again, prevent mosquito bites through the different preventative measures of insect repellent and things like that. But testing would become part of that norm without the symptoms and again, following that symptom.
Very good.
I have a couple things, Mark.
Yes.
One thing is, if we have people listening who don't have doctors, which is not always the issue from our standpoint, we do have a resource at the hospital hired specifically to handle people who need to find a doctor. We could publicize that sooner than later. And we haven't really touched on the OB physicians' offices. I think that could be a good resource for making sure they have the most current information for their.
And like I did, when we did the slide presentation, OB offices have been on board all along.
Oh, good.
Because
Well,
of-
I didn't know.
Because UH, Dillon Crew, McDonald House,
Oh,
and
McDonald
have
House,
a lot of,
right.
they've been in all the OB meetings and stuff, so those offices have had a lot more detailed information than we have seen within the hospital because of that seriousness with those OBs.
Well, good comments, because,
Yeah, maybe not so much on the OB floor.
and I guess, I was sitting back there listening, and I guess I didn't pick up on that right away, and so the question was
Yeah,
asked,
no.
and now we all know.
Like I said, we didn't hit on it very much. Right, very briefly.
So, okay, anything else that, as far as content goes? What about structure? What do you think, yes?
What about urgent care? Are they in the loop too? People go to the urgent care?
They're independently owned and operated, so they haven't typically been invited into, but it doesn't mean you're not part of the,
And we reached out to the docs and lots,
not that I'm aware of,
just saying.
not that I'm aware of.
Heard of it, heard.
Well, you wanted to reach out to the schools.
Yep.
So you can put them on the list too.
Yeah.
Put schools on the list, we reached out to the university, I think it's only fair we reach out to schools.
The documents.
I'm just thinking too, if they don't have a primary physician, if they don't come to the ED, maybe they would go to an urgent care. Are they informed?
Right, your CVS Minute Clinic.
Oh, that's another good, that's being very frequently used by many people.
And they're very receptive to education, so.
And we'll make sure that this gets relayed to the Ashland Christian Health Center. I sit on the board now.
Yeah, who else
Dr.
was
Snyder, yes. I'm sure that Dr. Snyder's aware of what's going on, but,
Yeah.
And I was thinking too, we're talking about travel history, we are seeing not just Zika, but some of the other issues with our churches in the area that are doing missionary work and are traveling outside, and we've seen not Zika, but some other, infectious issues of travel.
and whether it makes the media or not, on a daily or at least weekly basis, we have people from our community and other communities in Ohio and across the country traveling abroad to different places and coming back within a 7 to 15 day time period because they went on a mission trip. There's several that leave Ashland and go on mission trips all the time. Those people come and go, and people don't see them come and go. And that's my point to what you said is we just don't see all the activity that's going on and the risks that are out there. But when those people leave and they come back, they run the risk of having been bit by something or bringing something back like we saw with Ebola and things. So we just need to educate and be aware of what those things are out there and make sure that we do a good job as healthcare and emergency management and public health to make sure that we educate people as best we can. And until the next, I don't want to call it the crisis of the day comes up, but it's whatever the public health risk is going to be.
I wrote a question here to kind of wrap things up. There obviously are a lot of loose ends that we can probably work on together. So I just questioned, do we create a working group, small working group, multi-agency working group to write a plan? By the way, there's some same plans out there. We wouldn't have really good ones that you could just tweak and rewrite a little bit, and we've got our own plan. But Sarah, from a public health standpoint, is that something you'd like us for a multi-agency team to kind of put something together for this and those other things that you want to kind of address from?
Sure, I think that would be valuable. From a public health perspective, to really encompass everything, we almost need to invite those who are involved with vector control to be a part of it. So mosquito spraying and things like that, because that's going to be obviously a component as we prepare and even respond to a Zika case or multiple cases. So that would be a good partner to speak with.
City spray this year?
They do, yeah.
I mean,
Yeah.
You said it was a low year.
right, I know it's a low year, that's why I asked, did they even spray?
Right,
Because
so, and again, moving forward, I think that because this is a topic on, state, national, local levels, we will probably see some more funding released to support activities such as mosquito spraying,
preventative messaging and things like that. So that kind of gives us the ability to really work into our community population.
That's our hospital, and they put school nursing up there too. Is there anybody else that you'd want at the table to help write the plan or think about it?
I know, it's going to take a little thought.
Yeah,
Yeah,
that's
you have
fine.
to look at all the facets, right? And I think we've got a pretty good start on it, but yeah, I might
Okay.
do.
So at some point, we want to come back together, that group of whoever you want there, and then you could host that, and we'll come